Gundy. I'm a pediatrician. I've supported single-payer programs for over 10 years. When I was practicing in Connecticut, I joined a group that actually tried to pass a single-payer program, and we got it through the Labor Committee of the Connecticut Legislature. The reason we did it that way is that the Public Health Committee was chaired by a lawyer who worked for Aetna Insurance Company, and she would not let it on the agenda. The program failed, but what inspired me to join this is that I got into medicine from a legacy of caring professionals. My grandfather was a pediatric social worker who became a hospital administrator. My mother was a pediatric nurse. My father was a pediatrician. I learned medicine not only in medical school, but in publicly funded clinics and working with a medical missionary in Haiti. I was shocked about 15 years ago when a 13-year-old patient of mine was diagnosed with the help of an endocrinologist with a brain tumor, with a pituitary tumor. And with the family, we discussed where to go. And the family had a friend who had another friend who recommended a particular neurosurgeon. The neurosurgeon, unfortunately, was not in that insurance plan. But the family got tired of waiting. They didn't like the alternatives that were given to them. And so they asked the insurance company to negotiate with this neurosurgeon if they would allow him to do the surgery. This was May, and finally in August, this 13-year-old girl with headaches and other symptoms went into surgery. The family and the surgeon decided to go ahead. On the day of the surgery, the morning of the surgery, I got an email from the insurance company, "Your patient is approved." 3 days later, after successful surgery, the girl was discharged. The family went to the hospital business office, and they were told it hadn't come through yet, and the mother had to get out her American Express card and pay for brain surgery with a credit card. And that, to me, was just shocking. The fact that they had to suffer 3 months of waiting and then go through this terrible financial stress led me to my conviction that a single-payer program for the United States, for each state, and especially for Vermont, is the way to go. Thank you.
I'm a registered nurse. I've been a nurse for 23 years. I'm a nurse educator at Fletcher Allen. I'm also the president of Vermont Federation of Nurses and Health Professionals and the chair of the Vermont Medical Response Team, the group that's been working alongside patients and providing medical relief. We've been working, the Vermont Federation has been working for years alongside the Vermont Workers Center and the Healthcare is a Human Right campaign. And I can tell you that my colleagues, my nurse colleagues, have cared for all of the patients that all of you are thinking about and talking about right now in the hospital who would not have been there had they been able to afford access to primary care. So we and our more than 2,000 members stand in solidarity with you. We want publicly funded, publicly administered health care, equal access with accountability and transparency. I was listening to a radio program on the way in, an ongoing discussion currently in the World Economic Forum telling us what we already know. Big bankers are listening now to the issue of inequality and the impact that that has on our neighbors and community members. Epidemiologists are saying again that the folks who don't have access, don't have money, that are in the lower economic strata suffer more. And they have poorer outcomes in relation to disease and chronic conditions. So to follow up on what Marvin was saying, we know that insurance companies, big farm, are going to be coming after us. Our elected leaders need us. We need to keep coming here talking with our legislators, working with single payer, working with healthcare as a human right. Keep coming back. Thank you.